Many thanks, Hakimat, for that background on Saturday discourse, and of course, still discussing exclusive breastfeeding. I have with me in the studio Mrs. Clementina Ebere Okoro, FCT Nutrition Coordinator. You're welcome to Saturday discourse.
Thank you very much.
Yeah. Okay, the 2022 Breastfeeding Week has thrown up so much attention to breastfeeding. Why exclusive breastfeeding?
Yeah, exclusive breastfeeding needs to be emphasized because that is the recommended way of feeding an infant. Most Nigerian mothers are breastfeeding. However, there are not a good number of the Nigerian mothers are not yet breastfeeding as recommended.
Yeah.
That is giving the child breast milk immediately the child is born, within the first hour of life, while giving only breast milk and nothing else. That is what we mean by exclusive breastfeeding. At 6 months, up till when the child is 6 months, it's at 6 months that other foods can be added to breastfeeding, along with water and other family foods. While breastfeeding continues for up to 2 years or even beyond. This is the recommendation. The World Health Organization has brought this recommendation, and at the moment, only 29% of Nigerian mothers are breastfeeding as recommended.
So
yes, that is only one.
What could be responsible for the low rates, despite all the emphasis, all the sensitization? Why?
Some of the reasons are partly for lack of information, and part of the objective of the World Breastfeeding Week is to inform all, not only just the women, but the various actors in the warm chain, the mothers, family members, community members, even policy makers, decision makers, healthcare providers, different actors, employees of labor, because they all have very important roles to be able to support or protect and also promote breastfeeding. So this emphasis needs to continue to be there.
There's this practice by working class mothers where they express this breast milk in containers and then keep so that they can actually go on with this exclusive breastfeeding. What's your reaction on that?
Very, very good. In fact, it's part of what we encourage mothers to do, so that the mother will be able to achieve the 6 months of exclusive breastfeeding. When she's going out, if she cannot take the baby along with her, some work environments do not have, it's not yet baby friendly. They do not have like a lactation space or a crèche where the babies can be kept. And most workers, like government workers, they are only entitled to 4 months maternity leave. So, and at 4 months, the child has not, is not yet up to taking other foods. So the child needs to be on exclusive breastfeeding. And how do you now achieve this? The only way that this can be achieved is through expression of breast milk, whereby this will be kept, and then anybody that is taking care of the child, the caregiver, can now give the expressed breast milk to the child and until the mother comes back.
Okay, talking about the mother, there's this practice of surrogate breastfeeding. I don't know. What's your comment on this? I know it's still breast milk.
Yes, exactly. The whole essence of that is to ensure that the baby gets mother's milk.
Be it from
the mother directly or from a wet nurse or surrogate. Yes, because of the importance of breast milk. That is why, rather than giving infant formula, that is the first option of giving a mother's milk. Remember that we are mammals, and mammals' way of feeding is by breastfeeding.
Okay, this discussion is getting more and more interesting. Very important topic. Everybody went through that as a child, and I can see advocating that more babies should get that natural feeding formula. Before we continue with the discussion, we'll take this report on sustaining exclusive breastfeeding of infants, and setting up support facilities and flexible working arrangements for nursing mothers formed the highlight of FCT Town Hall meeting for 2022 World Breastfeeding Week, as Serafina Okonomekwe brings us details.
The importance of breast milk in the life of a child can never be overemphasized, as latest statistics by the Ministry of Health puts exclusive breastfeeding at 29%. Thus, medical experts say if there must be reduction of infant mortality, all hands must be on deck to ensure exclusive breastfeeding for 6 months. This figure, key players say, is a call to action for Ministry of Health to step up campaigns on exclusive breastfeeding nationwide.
We should declare state of emergency in the issue of exclusive breastfeeding, because it's belonged, our indices in the issue of exclusive breastfeeding has been crawling and walking like a chameleon, because most of the women doesn't want to do exclusive breastfeeding for so many reasons. Some of them will say the breast will sag. Some of them will say, I still want to maintain my shape.
Breastfeeding and exclusive breastfeeding is the foundation for life. It's the most effective nutrition for a young child.
Director FCT Primary Healthcare Board, Dr. Rukaya Wamako, in her interactions with participants expressed salient views on the benefits of building a strong immune system for infants, improving the capacities of healthcare workers, and carrying out more enlightenment campaigns, especially for rural communities found to have cultural inhibitions. The meeting also threw up engagements between various categories of health workers and nursing mothers on a wide range of issues ranging from breast milk substitutes to calls for action on training and retraining.
So we go back today, we're still going to encourage them so that they will not stop this breastfeeding. Let them continue with this breastfeeding because they have seen the advantage of their children.
And that is why we advocate for early initiation, putting
the nation's healthcare system on breastfeeding, and the National Food and Nutrition Policy Vision envisages 65% by the year 2025. In Abuja, Serafina Okonomekwe, NTA News.
Thank you, Serafina. Lots of activities there. Line up. I can see this is your week. Talking about the breastfeeding week, It involves all of us actually.
Exactly. So we need to galvanize actions to step up for breastfeeding.
We're hoping that all those actions will come to reality when every mother will know that it is important for me to breastfeed my baby exclusively. Now, there's this. What are the likely causes now of difficulties for mothers to breastfeed, especially young mothers? I've heard of a couple of people who say on the first or second day the breast milk is not coming, and some of them experience lots of challenges, some swollen breasts and so many other challenges like that.
Okay.
Yeah.
That's true.
You're all smiles.
Yes, some of those difficulties and challenges, like you asked, what could be some of the causes? Yes, some of them are caused like due to delay in initiating the child to breastfeeding. Like, remember I said that the WHO recommendation is for the child to start breastfeeding within the first hour of life. And that means that these mothers need to be supported. In fact, the decision to breastfeed starts from the antenatal clinics. Okay. The interaction with the midwives, with the nurses. Pregnant mothers need to be counseled. They need to understand, they need to know the benefits of breastfeeding, not only just to the child, but to themselves, to their families, to the community, to the nation, and to the entire world.
Okay, so having that breast milk the very first hour of a delivery is the best way?
Yes, it's the best. It's the best because it helps in overall lactation management. Like you mentioned earlier, sometimes swollen breasts, and that's what we call engorgement. That's because the breast milk, when the production is there, but there's no suckling to come out, to bring it out.
Okay.
So some of the challenges, like I mentioned, are caused by late delay in terms of on initiation of breastfeeding. Other times, some mothers too don't understand, and that is why we need to inform them. Education, we need to step up, educate them, support them, and then the health workers themselves are also overwhelmed with lots of work. But so the healthcare providers also needs to be well informed, and then they need to be educated. They need to be reminded of some of this importance, the things they need to do to support the mother right from the labor room. And then other challenges or difficulties are like plugged ducts, mastitis. These are different conditions. Even inverted nipples or flat nipples are also challenged. And all this can be corrected, from
proper information.
And then support by the healthcare providers. Exactly.
Thank you so
Even
much.
The way the mother holds the breast, the scissors hold, can also predispose to some of these conditions. Yes.
Mrs. Clementina Ebere-Okuru, FCT Nutrition Coordinator, we thank you so much for sharing your thoughts with us this evening on this all-important topic, exclusive breastfeeding. Thank you for coming.
Thank you so much.
You're welcome. And the discourse continues in just a moment. That will go on sports, but that will be after this break.